Hi, everyone. Thank you for joining the Labor Organizing Breakout Session at the 2021 SNaHP Summit. Our guests today are Dr. Andy Hyatt. Andy Hyatt is a third-year psychiatry resident at the Cambridge Health Alliance Harvard Medical School Adult Psychiatry Residency Program and was a former SNaHP board member when he was in medical school at Boston University. Currently, he serves as a PNHP board advisor, as well as a member of the board of the Massachusetts chapter of PNHP. He is also the Regional Vice President for Massachusetts in the Committee of Interns and Residents, a healthcare union representing more than 17,000 interns, residents, and fellows. He's specifically interested in organizing new hospitals after the COVID-19 pandemic and the link between workplace organizing and winning progressive policies like Medicare for All. Our other guest is Rachael Ballard. Rachael, MSN RN, is an acute care bedside nurse with a diversity of experience ranging from telemetry to intensive care. As a member of SEIU 721, Rachael has served on the nursing union's COVID task force, the rank and file bargaining unit, which fought for the Los Angeles County Department of Health Services healthcare workers to receive airborne level PPE, paid sick leave, and critical care training for nursing staff. Above any professional identity or credential, Rachael considers herself to be a worker first. She is committed to fomenting the class solidarity and unionization among healthcare workers that is necessary to achieve single-payer healthcare and dignified workplace conditions. Our panel today is moderated by Lee Alan, who is a member of SNaHP National's media team and is a first-year medical student at Johns Hopkins University.
Thank you. Okay, so we're going to start with a question that is more directed towards Andy, but feel free to chime in, Rachael, as well. How are resident unions formed, and how does one organize with your coworkers?
That's a great first question. I'm definitely curious. I think there's a couple specific things about how resident unions are formed, but the process for forming a union is pretty similar across any healthcare workplace. I'm sure Rachael has some insight into this too. Because first off, I'm just super excited to be here. Loved my time in SNaHP, continue to love my time in PNHP, and I've really seen kind of organizing with my coworkers is the way to achieve kind of these goals, and that it's a way to build power, because as we kind of talk about in all our organizing trainings, that divided we're very weak, individually we're very weak, even as physicians who are theoretically supposed to be kind of high powered and respected. You'll kind of get into the workplace and realize that that's all kind of a load of because we're recording, so a load of things that are not true. So in terms of how you go about organizing a kind of a union, so really kind of backing up really quick, like from the 30,000 foot view, like what is a union? A union is you and your coworkers organizing and acting collectively to kind of achieve the ends that you want in your workplace, in the political sphere, and in the community. There are kind of formal ways, of course, that the kind of federal government and the National Labor Relations Board kind of formally recognize unions, and kind of there's legal status with that kind of goes along with that. But really fundamentally what it is you and your coworkers working together and exercising power collectively. So the first thing you do if you're at a non-union hospital, let's say that you just matched and you're going somewhere and it's a non-union, probably about 1 in 5 residencies now are unionized throughout the country, mostly through CIR, my union. There are a couple of independent house staff associations. So University of Washington has a house staff association. I believe University of Michigan does. UCSD does as well, though they're likely joining CIR in the next couple of days, actually. So if you're one of those places, you should just get involved in your union, become an activist, and kind of help organize your coworkers. And if you're not, then the first thing you do is you listen. A good organizer is not somebody who kind of talks a lot or talks at people and tells them what to do. A good organizer is someone who can understand the flows of the workplace, can understand what people's issues are. And so when you get into a new job, you have to just listen, like what are people's concerns? What do they like about their job? What do they not like about their job? During kind of the COVID pandemic, it was like, okay, what are people pissed off about? What do we think is going well, which is usually not very much. And what are we worried about? Is it access to PPE? Is it kind of appropriate staffing on the wards? Is it appropriate supervision from attendings? Is it not being asked to pull so many night shifts that you can't even see straight anymore? And then you kind of figure out what is, and then you figure out, okay, who are people who are thinking similarly to you and thinking about, have the similar concerns, and who are people that have the similar frustrations to you and to each other. And then you just start talking to those people. You kind of start asking, like, hey, like, I hear, I'm also like really frustrated with not having N95s when I'm taking care of a patient who's like crashing and we're intubating people with a paper mask, or I'm also like, I hear that you're kind of frustrated about the lack of, protections for pregnant and nursing mothers, say on the wards or in other places. And you ask them like, what would be different if those things were kind of not true or not there? What do you think we could do to kind of change those things? And then you start kind of gathering people together who kind of think along those lines. And that's called, in labor speak, it's called forming an organizing committee, which is just kind of forming a group of kind of like-minded coworkers from ideally, usually often a unionization drive starts in one part of the hospital or one department. So, maybe it's the psychiatry residents or the IM residents who start kind of like talking to each other. But what you want to do is start finding who are the other people, who are the leaders in other departments who kind of might be sympathetically minded towards you. Who are your former SNaHP colleagues that are in like other parts of the hospital? Like you laugh, but like a bunch of my like former like SNaHP people who I met through SNaHP are now on the CIR board with me, and are people who I like got involved in like progressive organizing my union are like through SNaHP. And you try to get people, okay, like I'm in medicine, but who in OB kind of seems like a leader and is kind of taking on some of this stuff. Who in pediatrics is thinking about this. And then once you have a group of people, it can be as few as like 10, 15 people from across the hospital. You can reach out to an organizer. You can reach out to CIR, my union, here to me specifically if you would like, but every union has a kind of new organizing department with info on their website. And you can reach out and be like, hey, we have this group of residents who are interested in kind of organizing and unionizing. Can you like meet with us and tell us what the next steps are? And our organizing director will take a call with pretty much anyone in the country, and we'll kind of talk with you, kind of see where you are, kind of see what the next steps would be. So I'll leave it there for right now. But I think the thing I just want to emphasize is that there's nothing kind of like secret or magic about it. It's just about kind of bringing your coworkers together. It's just about kind of bringing people together for like a common purpose and exercising collective power. All the kind of formal legal stuff comes later, and that stuff is important and it's necessary, but without the first step of kind of building that sense of even just a little bit of collective purpose among your coworkers, it can't go anywhere. But once you have that collective purpose, everything else becomes much easier. And basically, once you kind of have that organization, you start to act like a union before you even kind of have a formally recognized union. So that's what I would say about that. Rachel, if you have any kind of thoughts about that, you're welcome to jump in, or I know I'm sure it'll kind of come up elsewhere as well.
I'll just say I really like one thing that you highlighted, which is something I like people to always remember, is that every complaint, every bitch sesh, sorry to cuss guys, but it's an opportunity, right? Because when people are complainers, right, what they're really saying is, I'm disenfranchised and disempowered in my workplace. And so that right there, if you're trying to form a union, that is an organizing opportunity. Never let it go to waste.
Yeah, great advice there. Now, Rachel, I have a question more directed towards you. How do the roles, responsibilities, and tactics of nursing unions compare with what Andy talked about with CIR and other resident unions?
Sure. I mean, I think just like physician unions, or really any union, right? We're going to do the basics. We're going to use collective power and bargaining to fight for good working conditions, good pay, better hours, safety, benefits, all of these things. And of course, the other important thing that nursing unions do is they protect us from unfair and unjust treatment from the bosses. When it's me, a single bedside nurse, against a manager or an administrator, and trust me, I have been in these situations, me and my big mouth, that's a huge power differential. But when I have my steward next to me, or, in certain cases, your union lawyer, now the playing field is a little bit more level, because we've got someone that knows labor law, that knows the bounds of our union contract and all of these different things. Now, in terms of where nursing unions and physician unions, I think, diverge a little bit, is in terms of kind of rhetoric and tactics. I do think that nursing unions rhetorically and tactically have had the ability to be a little bit more militant, in that they can deploy the strike, right? So, that's probably the biggest tactical weapon in any union's arsenal, is going to be work stoppage. And so there's a lot of reasons that have constrained physicians from being able to actually go on strike. I mean, there's legal issues. The employer-employee relationship isn't always there. And then there's also issues like physicians are carrying this huge debt burden, and the risk of professional retaliation or consequences is really, really high. And I think what I would like to see in the future is when nurses go on strike and there is a physician union in the same hospital, or even just, an organizing unit. They don't have to be an official union. I would love to see nurses, when they go on strike, for physicians to kind of join in and in more covert ways support the strike, whether, that can be anything from not writing billable notes to, getting out in front of the cameras and saying, we support this nurses strike. This is what's best for patient safety, and, amplifying nurses' demands. There's kind of a spectrum of support that could be there. And then the other thing I think that nurse unions are really a little bit different is the issues that tend to activate nurse members tend to be things that are directly and obviously beneficial to patients, because our working environment is the patient care environment, right? The vast majority of union nurses are bedside nurses, whether in the inpatient hospital setting or in like long-term care, things like that. So when I fight for better ratios that are, number one, going to help me not be as miserable at work, it's going to give me, more time to make sure all the meds I'm giving are safe. I can actually turn my patients every 2 hours, all of these different things. When I fight for better ratios, that is so immediately obvious and beneficial to the patients that I'm caring for. They just know they had stellar care at this hospital. They got to see their nurse all the time, and people took time to explain their procedures and their meds. So I think it's a little bit easier for nurses when they're having like when they're going on strike or they're having some kind of a drive, that we can make the argument that the things that are good for us are good for the patients, because it's just so directly connected. So it's easier for us to make that leap. Actually, I'll leave it at that. Mm-hmm.
And if I can just jump in real quick, I think, Rachel, I think those are all like really excellent examples. I think the nurses union has really been an inspiration to kind of bust us kind of other sectors of labor, and then also in kind of other organizing. And I think a lot of the stuff you talk about is also true of physician labor as well. It's true of lots of healthcare labor, that our working conditions are patient care conditions. And I think it's really the nurses have built this, this didn't come from nowhere, right? You guys weren't always this well organized. So you kind of built this power and built this kind of strategy. And I think physicians have a lot to learn from that. And I think especially in the issue of like the strike, I think that's been something that has been very hotly contested. It hasn't happened recently, but there were a lot of resident strikes in the 60s, 70s, and 80s. And there was a particularly famous one at a Cook County hospital where there's a lot of PNHP pedigree at Cook County in Chicago, but they struck for patient care conditions in the mid 70s and won huge advances there. So I think there is this precedent that I think a lot of us would really like to recover and kind of get back to that tradition.
Yes, absolutely. In preparation for this, I was like, you know what, before I go dogging out the doctors here, let me look up their history of going on strike. Apparently, I did not know the physicians have a long labor history of like pretty militant, union strikes, and they did hard time. Some of them went to jail to get the patient safety conditions that they needed. So if y'all want me to drop a link to this one particular article, I will. But yeah, I think that the legacy is there for physicians as well. And we need to dig up that history and remind people who they really are.
Yeah, thank you both for highlighting that important history. Moving on to the next question for both of you. How can medical students in the single payer movement support labor unions? Because we can't just expect unions to get on board with single payer without showing up for them first.
You want to take this first, Rachel? I can go first.
Sure, I'm sure.
Yep.
Well, I'll just say, I think, and Andy, you may have more insight into this because you're staff, but, I think there was kind of a point where single payer was contentious with organized labor because healthcare benefits are one of those products, right? One of those things that like a union can fight for and that's on the bargaining table, and that they fought really hard to get these good healthcare benefits, and they're thinking like, what do we have to show for all our work if single payer goes into effect, right? But I think we've kind of like, it's my sense that organized labor has moved past that they see now that like, if we have a single payer system, this is just one less thing the bosses can hold over our head. And that, we can move on to things like, if it's healthcare for nurses, it's ratios, or, it can be, safety conditions in a mine or whatever.
Yeah, and I think just kind of going from there too, and like I think there's the question that was asked was how can like med students and healthcare workers be in solidarity with kind of existing organized healthcare workers, whether it's nurses, techs, support workers, things like that. And I think that has to be, I think a big part of that is just making contacts with rank and file. So rank and file just means kind of like everyday nurses, workers, like not necessarily you have to become best friends with the union president, but you're like, getting to know the nurse who works on your floor, or the kind of techs who are wheeling your patients to CAT scan, and kind of getting to know what's going on with them. And I think some of the most fruitful solidarity that we've been able to have between unions at my hospital comes from those, my like friends who are nurses on our kind of med surge floors, and kind of hearing from them about when they're having a standout for their contract, and we show up in white coats, and then kind of vice versa when we're kind of agitating for better conditions at the hospital, they kind of show up for us. So it's kind of it's this relationship building. It's both showing up for people kind of unannounced, but then also kind of intentionally cultivating those relationships. So both now when you guys are residents and attendings in the future, it's kind of having those relationships. That way when something's going on, and then that you can kind of when the nurses are kind of walking out, or there's going to be a strike, that you can kind of be there and support them. And then I think more broadly, we should also like realize that we're all workers here too. And that like, it's not just about us being in solidarity with other like, classes or different professions, is that we should be organizing ourselves too. And I'm going to sound like a broken record during this panel, but a big part of that is going to be organizing ourselves as well.
Mm-hmm. Yeah, just to piggyback off what you were saying, literally on my notes here, I have underlined show up, right? So the way that you can always foster goodwill and build connections is like, when you see another union doing anything, right, show up for them, amplify their demands, strategically deploying whatever clout that you have, and follow their lead. An experience that taught me a lot was the UTLA, so the Public School Teachers Union. They went on strike a few years ago, and at that time I was a member of Democratic Socialists of America, LA. I was on the labor committee, and when I tell you that, it taught me so much. Our DSA members, we showed up on their picket lines, and it literally doubled the number of people on their picket lines. And I'm gonna tell you what, it's a lot more intimidating if you're a scab when there's 100 people blocking the doorway. And that goodwill that we built with those teachers had ripple effects that credibility, you can't buy that at the store, So I just think that, if we want to make sure that unions are on board with single payer and then are involved in building that movement to gain that, showing up for them and listening to the things that they need, helping them out. And that's how we build a movement together.
Great. Now zooming out even further, next question is, how can building labor power build power for progressive politics more generally?
Been thinking a lot about this one recently, and there was a piece published by Natalie Shore in the New Republic a couple weeks ago that I spoke with her about about the PRO Act, which is a piece of labor legislation that is maybe on the cusp of getting passed in Congress. We're three senators away from getting a majority, and it's already been passed by the House. But that would be the most like progressive pro-union legislation since like literally like the 1930s, and would kind of greatly make it much easier for people to form unions and kind of expand the number of tactics that unions are allowed to use and kind of fighting for progressive change. I'll drop that in the chat in a second, but I think that's such a really great example of how DSA is kind of leading this campaign. The DSA campaign for the Green New Deal is on board. And there's this realization that without an organized working class, and with that, I mean, the working class is everyone who works for a wage for a living, which is most of society. Without an organized working class, we're not going to win any of these demands, right? Like, we know that the hospitals, pharma, insurers are so powerful and they have so much money, and they have so many of our politicians like in their pockets. Like, we all kind of know that that's true. And we don't have that kind of money. We just don't right now. So we have to build a like militant movement, not just of people who will say yes on a survey to whether they want Medicare for all, but who will show up in the streets working for it, but who will shut down their workplaces, who will kind of picket and like disrupt, the actual operations of these groups. And one thing I would highlight in particular as to how these issues can intersect is that the opponents of healthcare unions and the opponents of single payer, it's a circle. It's like the same people who want us to have bad working conditions, and not get paid enough to pay for student loans, and to not have enough supervision from attendings, and to take care of way too many patients, are the same people who are pouring money into America's healthcare future and to spending money on anti-single payer ads. And so, like, it's the same boss we got to fight. And we all know the hospitals, despite their image, are pretty bad actors in this regard, that the Hospital Association supports tons of money into anti-single payer ads. Despite their nonprofit status, we know that most of these hospitals are, basically giant corporations that have a technical tax exempt status. So I think we have to realize that we've got to build power. We got to build our own power, and unions help do that. And we have to decrease the power of our enemies, and our enemies are the bosses, both in the workplace and in the political arena. It's one and the same. And it's, in this way, it's a zero-sum game in a good way, that the more power we build, the less power they have. And if we have forced them to come to the bargaining table and spend more of their money on, having enough nurses at the bedside to make sure people get good care, and to paying people appropriately, and to make sure it's appropriate supervision, there's less money for them to spend on lobbying and all this like bullshit that they would normally spend it on. So us kind of gaining at the workplace directly kind of decreases their power. And that also builds confidence among kind of unions and among working people that we can kind of win change, and that like makes people kind of, that is like it's an additive effect. And then you kind of, the momentum starts rolling, and you can like start pushing for things that are not just in your workplace but are kind of broader.
That was fiery. I love that. Yes, I co-sign everything that was just said. And I'll just add that, like, when unions are doing their job really, really well, when labor is at its best, you go beyond just the little local work environment of like fighting for this little segment of workers' conditions. And the union then goes beyond that to investing in political education and the political activation of its members, and then political education and political activation within the larger community, right? That's when a union is at its best, that's what it's doing. It starts to dream bigger and set its sights quite a bit higher. I think one of the most inspirational nursing unions, National Nurses United, that's our most militant nursing union. I was SEIU, and don't get me wrong, I love SEIU. I'm proud to wear purple, but National Nurses United, they have educated their membership about who the real enemy is. We're not here to be friends with the admins and execs and the bosses. That's not, nope. That's the people that's the same people that's messing up our ratios, and that's throwing hundreds of millions of dollars at lobbying to prevent single payer. So, when we build the labor movement, we have more sophisticated political actors. It reproduces itself. Wonderful.
Now for this next question, both of you have touched on pieces of this already, but feel free to add as much as you see fit. What do various groups bring to the movement between physicians, nurses, advanced practice clinicians, other healthcare workers, and what should physicians know more about the nursing perspective and vice versa?
Andy, you don't want to go first? Okay. So, I mean, I'll just say this. I feel like nurses bring the numbers, right? We comprise the vast, literally numerically, in terms of who are healthcare workers. Most of them are nurses. So I think nurses bring the numbers, physicians bring the clout. I think what remains to be seen is the role that advanced practice nurses are going to play in the political landscape, because it really could go either way. Are advanced practice nurses going to identify with that sort of petite bourgeois professional managerial interests, which is the dead end street, sorry to say? Are they going to identify with that? Or are they going to identify themselves with the working class? Ideally, they will identify themselves with the working class, and advanced practice nurses could be a really valuable tool because so many of them work in the community setting. APRNs could be a really valuable tool with community outreach, and really, again, it's that political education and activation thing. Like they have the ability to make arguments that really speak to what's going on with everyday people, in particular in like, you know, the primary care setting and stuff like that. But we'll see.
Yeah, just to jump off that, I think we'll talk a little bit about the like internet kerfluffle over like provider and like the advanced practice question a little bit later. I mean, I think I can foreshadow that, but I like literally don't, like, I couldn't give two, you know, whatever. I could not care less about this when we have like the problems we have. And what I think it does demonstrate is that physicians and a lot of healthcare workers, but physicians especially, have this kind of guild mentality where, like, for so long we've organized not necessarily as workers, but as these like upper class, professionals. We're like, you know, all physicians, you know, owned their own business, which is their own practice. But like those days are gone. And I think people don't really realize that like the number of physicians who are like own their own practices or who kind of exercise that independent power is just like, doesn't exist anymore. That world is like rapidly disappearing. And I think what I want for physicians is to recognize that that's true, and that we're all workers now. We're all almost all of us are employees. So, you know, we get a paycheck. We like aren't these independent contractors anymore. And so we have bosses and we have people that tell us what to do. And I think for, you know, I want nurses to kind of realize that as well. And I think nurses generally do. They kind of have a better developed sense than we do. But I think that's something that's really important for us all to recognize, that like that guild mentality just gets us fighting amongst ourselves. And like, you know, like, and then what's it really kind of like coming down to? I don't know. And that's something that's coming into psychiatry, where like there's just such a huge shortage of people, even with nurse practitioners or PAs. Like none of us are going to have trouble like finding a job. It's like, why are we training our fire on people who like could be our allies? But I think it's a tricky question. I'm sure someone will yell at me at Twitter about that once I'm quoted. But so I think that's kind of my thoughts on that.
Okay, thank you. And this one's more for Rachel. What would an equitable single payer system for nurses look like?
I knew you were going to ask this one next. You know, I'm going to be honest with you. I don't particularly have many fears about what it, like if single payer came into existence tomorrow. You know, I don't know that single payer would much change the vast majority of nurses' structural relationship. You know what I mean? Like, I'm already very much in like an employee-employer relationship. All that's going to mean for me is that, you know, I definitely have healthcare and my patients definitely have healthcare. So I see nothing but benefits. I do think that when we start talking about becoming a totally nationalized system, like if we were all government employees, you know, I would like to see something a little bit closer to Cuba, maybe, where physicians are a little more on the unit with nurses. And the reason why I would want to see something like that is because us being alienated from each other in no way benefits patient care. And it disempowers me as a nurse in that, like, the long hours that I spend one-on-one with these patients I would like to see that matter in terms of informing the plan of care. And, so often I feel like it doesn't, even though, you're missing out, talk to your nurses. But, if we were totally to restructure the healthcare system and make it fully nationalized, I guess, I would want to see nurses have greater say in the plan of care. But with regards to single payers specifically, I see nothing but benefits for us, truthfully.
Okay, great. And then this is kind of broad, but overall thoughts on the level of strategic organizing and power among the major advocacy groups and unions around single payer.
I think my basic thought here is that we need advocacy groups to act more like unions and to have the same understanding of power that unions have. And I think that's something that, that our organization has not always had the best power analysis for how we're going to win. I think sometimes, and seeing this as a dues paying member of PNHP who spent a lot of time in this organization, I think sometimes there's an idea among, especially academics, that if we just get the data right, then we'll win. So it's like, okay, if all we need to do is just one more time, just present a grand rounds on why single payer is good and we'll win. We've been doing that for a long time and we haven't won single payer. And so I think that says something about our power analysis, that it's not a lack of, education is critically important, don't get me wrong. It'll be super important when there's an active fight about this and the insurance companies and the hospitals and pharma are, pouring on lies and deception and, all this stuff, all this bullshit. And so it is an important piece, but it's not enough. And I think that we have to really kind of think hard about how are we going to build power. And, building power is not about giving lectures. It's about kind of organizing people. And, I'd love advocacy groups. I think there's some recognition of this. I think this panel is a good example that we have to build labor unions and other kind of, whether, labor unions, other organizations, the working class, tenant unions or, kind of patient, kind of true patient advocacy groups, not ones that are kind of astroturfed by pharma companies. What would it look like for patients to truly be organized? Is there kind of the movement around community health centers in the 1960s, or the Medical Committee for Human Rights in the 1960s that desegregated a lot of the hospitals? I think those are the examples you'd be looking towards in our past. So I think mostly what I want is for advocacy groups to kind of learn from unions and other kind of well-organized groups and thinking kind of deeply and long-term about how we're going to build power to win.
Yeah, I love that you pointed that out, because this is something that I often when I'm talking with my nurse girlfriends and we're just shooting the shit and whatnot. One thing that just in my few years of being in healthcare that I've noticed is that physicians are good at, so don't stop doing it, but tend to limit themselves sometimes to showing up as expert witnesses. We need doctors to show up as more than expert witnesses. We need to see some militancy. And I say that as someone who recognizes that nursing unions need to show more militancy, like SEIU. I'm looking at you. Come on, let's go. And we have work to do on our end as well. But I do think I definitely agree with what Andy is saying, that we're going to have to put a little more skin in the game and take some calculated risks in terms of hitting them where it hurts, assessing who the power brokers are and hitting them where it hurts, because all things flow through us. Healthcare don't happen without us. So let's not forget that at any point. In terms of the broad outlook, and Andy, your staff, so you may have a better broad outlook than I do. I definitely, I think the Bernie campaign defeat was a setback, big time. I think COVID has been a bit of a setback in that over the last year, we were so existentially threatened in a life or death sense that the labor movement has had to fight for just that day-to-day survival, get us our N95s, things like that. COVID-19 has been good in that it has really clarified what a failure the US healthcare system is. It is an absolute fraud. It is a failure, and there is no justification for this system continuing as is any longer. So that has been good. In terms of positive outlook, I'm looking at California. I think PNHP, the nursing unions. I think we've got some big stuff coming down the pipe in the next few years. I think Gavin Newsom wants to be president of the United States, and that what we may see is, instead of going for, in the immediate few years, a national single payer system, let's see if we can flip California. I'll be interested to see what happens. I'm hoping to be involved in that, obviously, flying back next week. But yeah, I don't, that's the good stuff coming down the pipe that I can see, is I think we could achieve California single payer in the next few years, because we've got Gavin Newsom in a good bargaining position. I think his backup is up against a wall, and we've almost gotten it before. We've come close. So we'll see.
Great. Next question, we've definitely touched on this a few times, but how does the existing medical hierarchy erode solidarity among healthcare workers, and how can this be combated? And do physicians by and large just reproduce professional managerial class / petite bourgeois interests in the healthcare space?
Yeah, I kind of gave away my answer to this earlier, and that I think it's mostly a distraction. But I think something that one of my or the organizer works in my hospital, that she said that I kind of have been thinking a lot about, is that one of the goals of a union, and our union in particular, is to help residents understand and doctors understand that we have much more in common with bedside nurses, with respiratory therapists, with the janitor sweeping the floor, than we do with the chief medical officer or the CEO. I think very naturally, I think medical school, medical education breeds this always striving for the next thing, always achieving, kind of moving up the ladder. And I think we should realize that I have basically nothing in common with the CMO at my hospital or the CEO. They have an MD. That's probably the only thing, but our interests are they're just not aligned. Whereas the interests of me and my friends who work on the med surg floor, or my friends who are nurses who work on our inpatient psych units, we want and we need the same things. And I think that should be kind of forefront in our minds, and that's something that kind of we should all recognize and understand, and that it should inform our advocacy, that we shouldn't just be oh, the CMO, he understands or she understands. I'll just go talk to them, appeal to their conscience. They're a doctor, they'll get it. It's that probably won't work. You can try, maybe it'll work, but it probably won't. But really, we should be okay, well, maybe the CMO doesn't care, but I think the rest of my residents do, and I think the nurses, we all face the same thing. There's no N95s for anybody in the hospital, whether that's the RTs, helping intubate people, or the intern on the ICU, or the bedside nurses, or people mopping the floors or sanitizing floors after a COVID patient's there. So I think that's the thing we kind of have to build. And there's one thing that I want from the labor movement and from organized kind of physicians and from advocacy groups, is to kind of recognize that fact, that we should stop looking kind of up for either for salvation or for someone above us to save us, and looking kind of side to side at people who are we're working with shoulder to shoulder every day.
Yep, I co-sign all that. And I just want to express some empathy for the position that physicians find themselves in, because medical training is so hard. It's so expensive. And so when someone tells you, hey, give up all that prestige identification that you have, you're thinking wait a minute, what have I done all this suffering for? You know what I mean? But in the end, it's not going to pay off. It's a total mirage, right? And it distracts you from who the real enemy is. When these little battles come up, right? What was the thing, the conversation about being called a provider recently, or always, the advanced practice nurses and PA discussion is so contentious. The one thing I always just try to focus people's mind on is, what is a bigger threat to quality of care and safety? Is it nurse practitioners? Is it PAs? Or is it the fact that half the people in this country can't even afford to come see us at all? And just always keeping that in mind, that these are distractions. These are complete distractions. I have critiques of advanced practice nursing education, and trust and believe it will have to improve, or it's just gonna, it'll destroy itself. But always keeping our minds focused on what the real big picture situation is, instead of the things that are like gratifying to our ego in the moment. You know what I mean?
Yeah, absolutely. And this is going to be the last kind of prepared question. So folks that have questions, feel free to just throw them in the chat or message them to the PNHP account, either one. So last question, we've also touched on this, but what are more effective ways for physicians and nurses to organize collaboratively for health justice, if any?
I think we've already touched on a lot of this. Yeah, I think just the idea of showing up for each other, I think that's kind of got to be the most important thing here. Yeah, the more we show up for each other, the more we kind of build those relationships. And solidarity isn't just like a theoretical thing. It's like it's actual like bonds in the workplace and of friendship and comradeships. I think just showing up for each other on the picket line, in the at the bedside when your nurse calls you. I co-signed the please talk to your nurses. I think that is some of the best piece of advice I got during intern year. And I think just recognize that we all want and need the same thing, and that we're working for the same goal. So yeah, continuing to show up and continuing to kind of amplify each other's demands, and recognizing that we're looking to build power together.
Yeah, absolutely agree. So more collaborative action between, nursing unions and physicians unions, great. But I would really love to see, I have a dream that, wherever I land at my next hospital, I'm probably going back to county. Let's be honest, I'm not cut out for anything but public health. I would really like to form, an organizing committee that's doctors, nurses, RTs, food service workers, kind of everybody, more of an industrial type. We won't call it a union, we'll call it an organizing committee. But, I think I would really like to see more of that, more industrial union action moving forward. But, in the meantime, always supporting each other's actions, always caring about what the other is doing. And then, distance between us, alienation breeds contempt and anger and resentment. And so in terms of my practices and just my daily life, showing up at work, to the non-union hospital on my recent travel contract, I carry this with me everywhere. It's just I'm nice, I'm fun to be around, and I make it a point to be friends with medical residents, interns, every physician. They sometimes think why is this girl talking to me? We're best friends, because I do want to be your friend. I do, because every conversation, every relationship that I build in the hospital setting has potential to be an organizing opportunity down the road, and it just breeds goodwill. So, I'm just always trying to build that solidarity and good feeling, always.
Great, thank you. So move on, we have a question. So someone's wondering your thoughts on CIR formation for long-term power building, given the temporary nature of residency versus the specific working conditions of residents.
I think that's an excellent question. I think that actually allows me to raise up something Rachel just said about industrial unions. And that's a term for having workers in a workplace or in an industry organized in one union, as opposed to broke up into lots of different ones. And right now the practice is that we organize by kind of profession. And I think that's pretty baked in. If I could do it all over again, I would have us be in the same union, because I think that's the way that we build power. And so, because I think there are limitations, these kind of we call it craft unions, where it's the nurses have a union, the social workers have a union, the RTs have a union, and people, it kind of balkanizes us, means we don't necessarily talk to each other. It means that we can kind of fight with each other, and pitting kind of workers against each other, oh, the nurses want this, oh, you residents aren't you so mad that their union's better than yours? It's all bullshit, but it works. These are boss tactics. So I agree with the kind of limitations of kind of a resident only union. And on a personal level, it just sucks, because it means that in a year and a half, I'm not going to be in this union anymore. And it makes me breaks my heart, that I can't keep organizing in the same way with these folks. I think it's the best tool we have for right now. But I think what that means is that we have to think about, okay, what does it mean to actually organize attending physicians. Like for a long time, attending physician unions were illegal because they were all working for themselves, and it was like what was the word? Like it was racketeering, because we were all just like, you know, it was price setting, price fixing, that we were all like colluding. But now that most of us are employees, like that doesn't exist anymore. That's not an issue. And so I think whether it's through CIR or CIR kind of becoming more of a there are doctors unions. There's the AUPD, the American Union of Physicians and Dentists. SEIU has a doctors council local. It's pretty small. So there are some hospitals that have doctors included in their bargaining units. So, but I want to kind of raise that up as I think that has to be the like long-term goal for us to build real power, is to build at least industrial formations, if not industrial unions. So industrial unions would be ideal in the long term.
Okay. Oh, go ahead. Sorry.
I did not have anything to say. It was an accident.
Okay. Just checking. So we have one question in the chat. I'll read it out loud in case you can't see it. Maybe a challenging question to answer given that you haven't finished residency yet, but how do you maintain class consciousness among physicians after they've finished residency once people have slightly better working conditions and paychecks as attendings?
Excellent question. And I really appreciate that Jacobin article that Megan also posted. That's a good one. So yeah, I think this kind of gets back to it. I think some of what it is that the reason we have to organize in residency is to start this class consciousness and start this kind of consciousness raising among physicians. So once you kind of learn that, you can carry it with you more. And then I think it's also this recognition that, like, you know, it kind of sucks to be an attending in a lot of places too. Like you also don't have that. I mean, you get paid a lot more, which is great, and you have some control over that. But a lot of times you don't have a lot of control over your own practice. Like you kind of think you get an attending, you can do whatever you want, but like your manager tells you how many patients you have to see a day. You know, you're kind of the CMO or the kind of the chief of your department kind of sets productivity goals, but you have to meet or else you're fired or you're pay docked. And I think to give an example from my own hospital, I think there's been actually some organizing among the attendings at my hospital, specifically in my department, because there's a lot of dissatisfaction with how many patients they're supposed to see a day, how much time they have for appointments, and people feeling like it's not adequate. And it's not. People don't have enough time. They have too many patients, and how they're supposed to provide good patient care if that's the case. So I think this same stuff still happens when you're attending, and I think it's the same stuff that the same things you do to organize residents, you do to organize doctors. And I think it's harder because there's so much less of a tradition of this, and there's so much less kind of a history of it in this country. But I think I'm seeing it after during the pandemic and afterwards. I'm like a hospitalist, you see a psychiatrist in my department. That again, we're not in private practice anymore. We're not in our own kind of mom and pop clinic. We're kind of hospital employees, and we kind of get told what to do, and people don't like that. If there's one thing doctors hate, is getting told what to do. So I think it's the same stuff that you got to do when you're a resident, listening to people's concerns and being like, okay, so what should we do about it? Not what should the CMO do about it? Not what should the hospital do about it? What should we do about it to get them to change? And that the people organizing in my hospital have already won concessions from the department because they're terrified of the attendings kind of organizing and becoming and building collective power. And so we can win things. So I think it's the same stuff. It's just the kind of goals, the steps to form a union are probably higher, but not impossible.
And then going back to the discussion a little earlier, are there any examples of craft unions joining to form a single formation that you can think of?
I think the auto workers is a pretty classic one. Rachel, is what I was thinking of. The UAW, which is the big auto workers union. It used to be that there was a bolt fitters union and a metal cutters union and a person who puts the door in the car union. But then in the 30s, in the midst of this big upsurge and kind of left socialist and communist organizing and the New Deal, people got brought together in these big, huge industrial unions, usually through strikes. That's usually kind of how it happened. Rachel, I don't know if you have any other examples of that come to your mind.
I don't. It's kind of halfway stuff. Technically speaking, SEIW, it's a lot of different types of industries and but they don't necessarily gather all that power together at once, right? So like SEIU 721, for example, has like 95,000 members. Nurses are not all of those members, you know, but you have to actually harness the power, you know, of the fact that it's nurses and environmental services and this type of worker and that type of worker. But yeah, I think the auto workers is like the best example. I guess we have a lot of work to do, guys. I guess it's up to us. Sorry.
It's always up to us.
We got to do it.
Great. Okay. Next question. This one's in the chat, but I'll read it out loud. Although doctors are workers, it has been really difficult, at least for me, to convince my med student classmates on labor organizing. And a lot of this, I think, is related to the prestige identification we touched on and the fact that many actually want to be in the admin power position or protecting current familiar or future wealth. Can we maybe use union power to actually get lower/poor students into medical school who might be primed to join the union or organize med students, specifically from poor/lower income backgrounds, although these students tend to be rightfully nervous?
I mean, I'm not a physician, but you know, something that I will always fight for is like free education. Like, I can only imagine what it would do for the class consciousness and organizing of doctors if they didn't have this enormous debt burden, right? You know, and it would allow, of course, like people from lower income backgrounds to become physicians. But working with, you know, the people that you have now in terms of like convincing other med students, other doctors, you know, I think you have to do a little bit of deprogramming. I'm going to make a book suggestion here, guys. Told you I was going to plug this book. This is a book called Virtue Hoarders by Catherine Liu. And I also placed a link to a YouTube video in our little chat thing. I think you have to read up on truly, like, what is the future outlook here, and what is identifying with those PMC values really is it going to really pay off in the long run? Because the reality is it's probably not, but it takes some, like, you know, deprogramming, unbrainwashing to realize that.
Yeah, I think that's super spot on. And I think, and some of it is also recognizing that it's people's experience that also changes them. You know, I think we have this idea, this is kind of my own personal bias, but we have this idea that you can kind of like argue somebody into your point of view. And like, you know, that sometimes works, but it's usually kind of lived experience that does that. And so I know a lot of med students who like politically radicalized in their third year when they kind of got in the wards, and you're like, holy shit, this. I had like someone who came up to me like very, very sincerely said something like, Andy, I didn't realize how bad poverty was until like I went on the wards. And you're at one hand, you're like, holy shit, like, all right, like, and you want to be like, what's wrong with you? But then you have to be like, you know what? I'm glad that you finally realized that. And so similar about kind of like, you know, forming a consciousness as like a worker and not as, you know, a future administrator. I mean, you know, we're always going to have some people who are going to want to be administrators, and you're not going to get every single person kind of on board in the same way. But people are going to have those experiences, whether it's on clerkships, whether it's as residents, where you get treated like dirt, and you kind of realize that the hospital kind of probably sees you as expendable. And I think that on its own is radicalizing. And I think you just ask questions about what people have noticed. Like, what's it been like to be, you know, a medical student and to like kind of sit there and not be noticed and kind of, you know, feel like everyone's treating you like shit? Or what's it like to be an intern and be working 85 hours a week for the equivalent of like $17 an hour? You know, when the union kind of nurses are making more than you, or the union janitors are making more money than you are. And so I think it's a way of kind of using those experiences that people have to kind of radicalize them, because you can't, like, one person can't just do it. People have to kind of experience things together. And so it's not writing people off. It's recognizing that those experiences radicalize people, and that you kind of can bring people kind of through that ladder of engagement. And, you know, starting with just being like, wow, like, why is the hospital doing this with my schedule? Like, that's, wow, you're right, that is really frustrating. Like, I wonder why that is. Or, wow, like, why is the hospital, you know, not hiring more attendings, but they're just giving us more patients on the wards? Turns out like our patient loads keep going up. Like, why do you think that is? So you just have to kind of accompany people and view them for it, which I know is like not an easy answer. I wish there was just kind of like, oh, you just say this thing and then they radicalize. But it's organizing's, it's, you know, it's hard work and it's long work. It pays off, but there's no shortcuts to power, as Jay McElvey, who's a healthcare organizer, kind of talks about. There's no shortcuts to kind of doing this. You just have to be in it for the long haul with people.
Shared struggle changes people. You know, like I'm more radical today than I was this time last year. The pandemic changed me a lot, you know, and it changed my fellow healthcare workers a lot. And I was more radical this time last year than I was 2 years before that, because actually getting in the hospital and seeing day after day the effects of having pretty much no access to healthcare until they're sick enough to go to the hospital, right? To see day after day what that does to people and how sick my patients came in, you know, that changes people. It does radicalize people. And then having also conflict in the workplace, instances where I'm being mistreated or we're being mistreated, and then, you know, instead of just complaining with my fellow workers, being like, you know what, guys, why don't we do something about this? Why don't we push back? That's the stuff. And when people achieve something little, it builds confidence and it starts to get the ball rolling. So it's like shared struggle is what brings people along on the path. You know, it really does. I know plenty of people, I'll just say like in like DSA and stuff, they were like born with a silver spoon in their mouth. And now they're out on the streets taking police batons to protect homeless people. But that, you know, it's just having an accumulation of experiences that help you identify with your fellow man, with your fellow workers.
Right, and we're quickly running out of time, but one final question. How do you balance getting people involved in organizing while preventing roles?
So this is a particular question in new organizing. When there's a phase, when you're kind of initially trying to organize a union, you don't just like go up to your manager and be like, hey, we're starting a union. Like you don't like, because then the boss will crush you. And like, because there's all these dirty tricks that the boss and your employer can use to like frighten people away. So you're right that early on you want to be kind of cautious. So you know, when you're growing an organizing committee, and this is where like union staff can be very kind of helpful in kind of helping you feel this out. But you want to start with people who you know you can like trust, right? You know, you want to kind of, when you have conversations with people, you don't start off with being like, hey, how's your lunch? You want to start a union? You like kind of, you start the conversation and like get a sense of where people are at. You know, maybe you know that there are some people who are, you know, have been in SNaHP with you or who are in like kind of left organizing circles, and you can kind of be more, you know, hear about what's going on and be a little bit more direct. And then you want to start with that kind of like inner core of people you kind of suspect will be kind of activists or who are already kind of primed to agree with you. And then after that, when you start talking with people who maybe you're less certain about, you start off very general, like, oh, how, you know, when you talk with somebody, and again, it all has to happen through conversation. When you talk with someone, it's like, oh, how have things been going? How's this happening at the hospital? How have you been dealing with COVID, XYZ? And then, you know, if they're like, you know, if they're hostile, they're like, everyone's just shut up, like there's no problems here. You're like, all right, cool, talk to you later. And like, you just kind of don't bring it up. Or you kind of, if you kind of get later in the conversation, they're maybe sympathetic and you say something like, oh, I like, you know, have you heard about people, have you heard in general about residents maybe organizing? And if they're like, oh, unions are evil, you're like, all right, well, yeah, I didn't really hear much, just didn't know if you did either. Or if they're like, well, residents can never be union members, you can ask questions, but you kind of do it in a way that like doesn't give it away. And anytime you can bail and be like, oh, you're right, I'm not involved in that. It was a rumor going around. I didn't know if you heard anything, like talk to you later. The good news is that residents, there's very like, it takes a particular kind of person to be like a dedicated anti-union activist, and they do exist. And the key is just to like not let them, to kind of keep them in the dark until things like get farther along. I saw Rachel drop some links to labor notes in there, which I think is an amazing resource. And for people who are interested, this book, Secrets of a Successful Organizer, is like a Bible for organizing, both for unions and also I think everyone in PNHP and SNaHP should just read it. It's like $10. You can get a lot of it free online as well. I think that's a really, really great place to start.
Yeah. And speaking of links, Rachel, we have a request. You mentioned an article about militant physicians and kind of the history there. If you have it handy, if you could drop that link in the chat, that would be great. But as we're wrapping up, thank you so much to our speakers. This was so informative and just, at least for me, very practical and useful information. A couple of reminders. So next will be the breakout sessions by region, and also just a general reminder of our call to action targeted at Congressman Dwight Evans. Keep at it, everyone. Yeah, and that's kind of all.
And I'm just going to drop the links to the next breakout sessions in the chat, but they should also be on the list that was emailed out yesterday when you got the links for everything. Yeah, and thanks to our speakers.
Thanks for having us, guys. And I know this will probably be said, but very happy to talk to anybody on this call about organizing or about labor stuff or single payer stuff in residency. My email, I think, is kind of attached to this, and very happy to chat with anybody. You can DM me on Twitter or whatever, doesn't matter. Happy to kind of talk to anybody who's entering residency, even if you're a first year medical student or wherever you are in the process. Really happy to talk to anybody about this.
Yeah, y'all, thanks for having me and listening to just a regular bedside nurse. I appreciate y'all. And if you're ever in Los Angeles, highly recommend working at LA County hospitals. They're pretty good for residency. And yeah, if y'all ever want to do any activist stuff in Los Angeles, hit me up.
Thank you again.